Tom Norton is a lucky guy.
It was a surprise.
A former major league pitcher,
Back in '72, I did play for the Minnesota Twins.
the avid outdoorsman survived a lightning strike in 1995, and luck seems to be on his side again.
Amazing.
But before we get to that,
Fighter pilots or jets pilots or even commercial pilots would always practice and rehearse what they were going to do in a simulator.
And hold to the left.
And we've always thought as surgeons, well, this is very complex. Why can't we rehearse the same way?
we have to rewind to 1927 in Binghamton, New York. Edwin Link, an aviation pioneer, is building the world's first flight simulator. It might not look very fancy, but Link's simulators trained 500,000 airmen during World War II. It's the same technology that also trained Israeli fighter pilots Moti Avasar and Alon Gary.
So it was actually, the story goes, in a coffee shop, and I overheard these two Israelis talking, and they were actually in Cleveland to design the flight simulator for the F-16.
Dr. Selman's curiosity was piqued.
And we started talking, and I said, that's exactly what we would like to do for surgery.
And so surgical theater was born, right here at University Hospitals.
It allows us to take 2D images, whether a CAT scan or an MRI, and incorporate that into a three-dimensional platform.
A 3D, 360-degree virtual reality experience, bringing a patient's anatomy to life.
Is this like a road map going in with a GPS? It pinpoints exactly where you're going.
And giving surgeons the chance to rehearse a procedure ahead of time.
It is a game changer because really, if you think what is the key to success in anything, it's really being able to visualize what you're going to do ahead of time, to visualize that success.
After a year of unexplained vision issues,
The MRI showed I had a mass in there.
Tom is now experiencing surgical theater for himself,
Not many people get to have a look around their entire skull here.
touring his own brain, seeing the reason for his blurry vision firsthand.
After they, showed me and everything, I'm pretty comfortable about it.
Tom's doctors say the mass is benign, and once it's taken out, his eyesight should go back to normal.
I think that's awesome that they can start showing you, by the glasses and that, looking in there and seeing the reality of it, what's going to happen.
The technology enhancing informed consent and patient safety, too.
Not only do I plan this, but we take the same technology into the operating room so that I know if I go 3 more millimeters, I'm going to encounter something I need to stay away from. So it makes surgery much safer. I've seen it before. It's a feeling of deja vu. I think that's about it. Thank you very much.